Now that you have taken home the wellness injection kit to inject yourself, it is very important that you read the instructions as they are laid out on this sheet step by step for a safe injection. On the back of this sheet, it is just the potential effects that may happen. It is mainly there for a reference if you feel anything that you have questions about. What we will do is go through this step by step. The first thing is you get your package kit to open it up. Within the package kit, you have your main syringes, which are between 2 to 4 depending on the injection formula that you have chosen, and they are all safely capped and with a color coordinated label. Next, you have your injection syringes, and it is the number of the package you have purchased, whether you have purchased a 4-pack, 8-pack, or 12-pack. It'll be the exact number of weeks that you will need. Along with alcohol swabs for the same number of weeks, and you will also have the same number of injection syringes. And the way you know they are injection syringes is that they are the gray hub instead of the blue hub needles. Now that you are ready to prepare your first injection solution into the drawing and injecting syringe, what you will do is take out one of these sterile syringes from their pack, ripping the bag out, and you have a 3 cc or 3 ml syringe with a blue needle hub, which is used to draw your solution. What you will do is then refer to how much of each solution you will need in here, and that is laid out for you particularly. It will say, for example, in this patient, 1 ml of the red colored sticker solution, 0.5 ml of the yellow stickered solution, 1 ml of the blue stickered solution, which are all here. So we will naturally start with the clearest color. This would be the first one. This is the blue sticker, and it requires 1 ml of solution. So what you would do is you would screw off this protective cap, put it in a clean space. You would also take your injecting syringe, make sure this cap is pretty tight so that there won't be any leakage. Then you remove the cap. Once you do that, you will enter this needle into the hole. You'll turn this upside down, and it is pretty secure, so you could use both hands concentrating on the bottom syringe. Now this solution requires 1 milliliters. So what we want to do is draw this, the top of this hub, down to the 1 ml mark. So we retract all the way to 1 ml. And at this point, I could remove this. Once you remove that, make sure that you recap it so that remains its sterility. And speaking of remaining sterility, just keep in mind that this needle is also sterile, so you don't want it to touch any other surfaces. If you do have to do something in between, what you could do is place the cap on there and then go do your stuff and come back and remove the cap to continue. So now what we need to do is go and get our next solution. And based on the colors, this yellow one is the next clear solution. So we will go ahead and remove our cap, twist this cap, go inside the hole again, turn it upside down. And at this point, keep in mind that your plunger is on the 1 ml mark already. And since you only need 0.5 mLs of this solution, you will need to move the plunger from 1 ml to 1.5 only. So we will go ahead and do that. Once you've gotten that, you will recap this, put it aside. Then we go to our third solution. At this point, if you do see quite a bit of airspace, you could easily just get that solution closer to that hole. And you are at 1.5 at this moment, so we will need 1 ml of this, so we will go to 2.5. Once you get to the 2.5 and you have recapped your last solution, you will go ahead and place the cap on this needle. Make sure to tap the bottom so any air bubbles will rise to this bigger airspace. You can now remove your drawing blue hub needle and take one of your injection needles, screw that on your injection syringe, and at this time you will need to make sure that this air bubble is extracted through the needle. So you would push the plunger until you see that red color go up this gray hub. And as you see it work up its gray hub and you feel just a tad bit of resistance, then you know that there is no more air in that syringe, and you could go ahead and remove this, and this syringe is ready to be injected in your muscle. Just a few tidbits about when you are about to inject into your muscle. Keep in mind the two muscles that you should be injecting is either your gluteal or your butt muscle or your quadricep muscle. Clean the site with alcohol 10 to 30 seconds before injecting. Once you are ready to inject and the needle is inside your muscle, it is important to go slowly. Take about 10 seconds per ml of solution. For example, if your syringe is holding 3 cc's or 3 mLs of solution, take about 20 to 30 seconds to inject that solution, as if you do inject it fast, it may clump up and may cause some soreness. And the slower you go, the more it has room to disperse. And for any reason, if you do get some soreness in your muscle, just rub it with heat or your fingers, and that'll relax the muscles and allow the solution to disperse.